Today we're talking about knee pain and what a drag that is. I'm going to walk you through everything I did in my journey to getting stem cell treatment and how that's worked out for me. I am a 56-year-old woman who is now very active. That didn't quite used to be the case. I am putting this up in November of 2024. The incident that started this whole journey for me actually started in April of 2023. Prior to that, I never had any knee problems. I walked the dogs, I exercised. Like pre-COVID, I belonged to a gym and had a personal trainer, and I was getting into that whole journey. And then pandemic shut down, knocked that out. And so I was still staying active, mostly through walking the dogs every day, but nothing in particular. Then one fateful day in late March, my husband agreed to go on a hike with me. He does not hike. So I said, no problem. We're going to go to my favorite spot. I know it like the back of my hand. We'll be gone hour and a half, maybe 2 hours. Oh my gosh. We got there. I'm like, hey, I've never taken this trail before. Needless to say, 10 miles and 4 hours later, oops. So we were coming back downhill to return to the car, and especially my right knee was starting to hurt a bit. With every downhill step, it just was not feeling great. But I went, yeah, I've been out here 4 hours. That is way more than I usually hike for. Not a problem. What I didn't know about these types of injuries, and I'll get to what type that is in just a minute here, is your maximum pain hits about 2 weeks post-incident. So whereas, I took some ibuprofen, I iced it a little bit, I was feeling okay. 2 weeks after that, it hurt so bad to go down the stairs. I had so much pain, largely in my right knee, but a little bit in my left. So I called up my doctor. I went to see her. She went, let's send you for an x-ray, which I didn't know anything at the time. I believe the reason why I was sent for a knee x-ray is they were looking for arthritis. Because arthritis, not rheumatoid arthritis, right? That's a autoimmune disease, but osteoarthritis shows up on x-ray. And so when they sent me for an x-ray, she was looking to see whether it was arthritis setting in my knees. I really didn't think that was the case, and that's exactly what the x-rays showed. There was a very minimal amount of arthritis in both my knees, so that was not the source of the pain. In the meantime, she prescribed physical therapy for me, and so I went to see the physical therapist. That started me on a whole other journey. I'm just going to share a little bit of it with you. So initially, my PT involved squats, lunges, clamshells, and doing the yoga pose bridge. And I was absolutely religious about doing my PT 3 times a week without fail. That, and my doctor put me on a 30-day course of naproxen. We know it as over-the-counter Aleve. Most Aleve pills are 200 milligrams. She put me on 400 milligrams. The idea was, let's get the inflammation down for 30 days and you start rehabbing your knee and let's see how you're doing. Well, after 30 days of religiously doing my PT and being on the anti-inflammatories, my knees were feeling a lot better. But there was one movement I did in particular where I was still having pain. I've got this yoga DVD, and you sit crisscross applesauce and then lean out over each knee. And doing that caused me sharp pain in the back of my knee, which I thought was really strange. All the pain I had had up to then was over the front of the knee and just walking downstairs or down a hill. So I went back to my doctor, who this time prescribed an MRI and sent me back to PT. My physical therapist gave me a few more exercises to do, a lot of one-legged work. And so I incorporated these new PT exercises into my existing leg routine. So I went for the MRI, and honestly, it ended up being one of the most confusing things ever. I go get the MRI, and I get a call telling me that the radiologist that reviewed the MRI said that there was a small tear in my meniscus. And the meniscus is kind of like the little shock absorber on your knee. The orthopedist that I saw said, no, there's no tear in your meniscus. Time out. Wait a minute here. Who do you believe? The radiologist who looks at these things all the time, or the orthopedist whose specialty it is? I was so confused, and I was venting to a girlfriend at lunch, and she says to me, oh, you've got to go see my doc. My knees feel like they're 30 years old again. I'm like, 30 years old? I want 30-year-old knees. And that's how I got hooked up with the good folks at Seattle Regenerative Medicine. I went to see Dr. Lucy Hostetter at Seattle Regenerative, and she did an ultrasound of my knees. Oh my gosh, you don't know what you don't know, right? So I'd had X-ray, which is really inexpensive technology. I had MRI, which is extremely expensive technology. Thankfully, we have really, really good health insurance. But then when she's ultrasounding my knee, I'm just literally looking at it on her monitor, and I can see a pretty large tear in my right meniscus and a much smaller one in my left meniscus. Well, there's your problem. Dr. Hostetler explained to me what they could do is take stem cells out of a bone, in this case, the rear part of my pelvis, up high on the pelvis in the back. They would take the stem cells out and inject that into my knee. One injection specifically into the tear, and the other one just in the general area of the tear. Stem cells are kind of cutting edge medical technology. And the idea is that these cells can become anything. And what my girlfriend had done and what I ended up having done was that procedure to shoot them into the tear in my meniscus, with the idea being that then those cells would regrow the meniscus. And what Dr. Hostetler told me was, this doesn't last forever. You'll get 5 or 6 years out of it, but if you do it every 5 or 6 years, you'll never need to have your knees replaced. So that was really intriguing to me. I started looking up any studies I could find, and there are some promising studies out there, but there hasn't been a ton of research on this. I did have the experience my really good girlfriend had, which is she absolutely loved her procedure. She's got no pain in her knees. So that was kind of good enough for me. The procedure itself was $3,500, and I understand that the price has gone up to $4,500 since then. And then the one option was whether you wanted some really good drugs at the beginning or not. I'm not exactly sure what it was. It was something I took orally, and then I don't remember any of it. Dr. Hostetler said she had it done on herself and she did not have any anesthesia or any drugs. She said it was a really weird sensation having the stem cells removed. That's like apparently this suction feeling thing that just, we don't ever go through anything like that ever. And then she said the injections weren't bad at all. They used some local lidocaine topical numbing for that. And the whole thing takes less than an hour. But again, I asked my girlfriend, she's like, no, I did the drugs. So I got the drugs. I didn't feel a thing. They were really kind. I said, hey, I would like to show this on my YouTube channel. And they agreed. They shot footage of the procedure for me. Now, I'm pretty squeamish. I haven't looked at it. Still, even shooting this, I haven't looked at it yet. The first time I'm going to be seeing it is when I'm editing it in right about here. So, heads up, I'm going to timestamp it for the procedure, and then I'll timestamp it when that footage is done. So if you're squeamish and you don't want to see it, go ahead down below, just jump ahead to the timestamp where I talk about whether it was successful or not. This is where they're puncturing into the bone. Prior to this, I think they gave me lidocaine, and of course I got it all cleaned up. This is hard to watch, but yeah, she's got to puncture into that bone. And now she's going to withdraw the stem cells from inside the bone. I am so glad that I opted for the drugs for this. I would not have suffered this well. And this is a second syringe that she is filling. Okay, and I am just getting a look at all those syringes lined up on my back. This apparently is going to take a while. And now it's all done, and I'm getting a nice big Band-Aid back there. Then apparently they spun out the blood from the stem cells. They've got me flipped over and all prepped. She's using the ultrasound to guide the needle placement for shooting into the tear. And she did that procedure a total of 4 times, 2 on each knee. Well, it's about 3:15, and I got home, I think I got home around 10:30 or 11. I remember my husband coming to pick me up. I do not remember walking out of the clinic, getting in the car, driving home, none of that. And I napped for a few hours. You can still see I've got the marks from the cannula for the oxygen, and I'm not in too much pain. I am keeping ice on my knees because that is feeling better. Let me spin you around. I have some discomfort in my knees, but not really pain. And I mean, knock on wood, right now I don't feel the incision point in my back at all. So I got my fingers crossed that that doesn't give me any problems. Okay, so even though I feel like I look super weird and scary right now, I just really needed to record this. It is the afternoon after the day I had the stem cell stuff done. So coming up on 36 hours. And I am amazed at the difference between how I felt this morning and how I feel now. This morning, going down the stairs was a nightmare. It hurt so bad. Walking was awful. And like right now, I'm changing the sheets on the bed. I mean, don't get me wrong, I can still feel the discomfort, but my mobility is so much better. So yeah, this morning I was really, really miserable. And now I'm just mildly uncomfortable. What an improvement. Specifically, I took these notes. At 24 hours post-procedure, my knees are stiff and the puncture site is tender to the touch and movement, but does not ache when I'm resting or sitting still, because of course there were 2 big punctures in my knees. Stairs are definitely a challenge. I find it easier to bend my left knee than my right knee. Right, there's a bigger tear on the right meniscus than the left. I go down the stairs with my right leg straight and bend my left knee. Sitting on a chair or on the toilet is still painful. It did feel good to get a shower this morning. I had to wait 24 hours to shower. Like I said, by day 3, I was largely back to normal. By day 4, I restarted my PT exercises, and I checked that with Dr. Hostar before I did that, and she blessed me for starting my PT back up. So since then, at 3 months, my pain was so much better. Before I had my knees done, when I was take the dogs out for a walk in the morning, I would put knee braces on both knees every morning. I haven't worn my knee braces since I had this procedure done 6 months ago. I have no more knee pain when I do that yoga move with sit crisscross applesauce and lean over. The pain in the back of my knees, totally gone. Every once in a while, I get a little knee pain. I'm 56. I am now extremely active. Getting that PT prescription was the best thing for me. It started me on lifting weights, lifting heavy, some serious cardio work. That's probably another video that I should do, but right now at 56, I am in absolutely the best shape I have ever been in my life. So for me, this procedure was totally worth it. When I look back at the notes that I took about, especially, wearing knee braces every day and the pain I would have, to now where no problems. I walk typically about 5 miles a day. I'm looking forward to this ski season. I'm not anticipating any pain this ski season. I can go hiking. It really has been tremendous. Having said that, it's really expensive, at least in our market, as I understand it now, it's up to $4,500. That did both knees, but insurance doesn't cover it. We have very, very good health insurance, very generous. I've been amazed at some of the things that it's covered, but it did not cover this. And so the cost is definitely something you've got to factor in. All right, and if you're still here, let me give you a little personal update on where I've been for the last year. If you're a long-time watcher of mine or a subscriber, this background does not look familiar to you. My oldest kiddo, my daughter, and her boyfriend were looking at moving out last spring. And we're here in the Seattle area, and rents are so expensive, and anything that was kind of nice or in a decent part of town was out of their budget. And they found this place, but it was in kind of a sketchy part of town, and I was not comfortable having my 21-year-old kiddo living in that neighborhood. So I talked to my husband, and we let them move in. We have a daylight basement here, and we put together a little kitchenette for them, and so they've been living downstairs now, which is where my studio was. So that made it really hard to shoot. Also, I decided I can't keep talking about makeup. Honestly, these days I hardly wear any makeup anymore. And so my channel needs to evolve. And I'm curious, what are your thoughts? Like I said, things that have really changed in my life over the last year, I am exercising so much more. If you're interested, I would love to share that journey with you. Also, out of nowhere, I put on 10 pounds after losing all that weight at the beginning of COVID and keeping it off for 3.5 years. Boom, it came back. I didn't change anything. And I am now about 80% done with losing that extra weight. And it has been a journey, let me tell you. Some of my most popular videos are my ones on HRT, and I am still on estradiol, but now I'm also on testosterone and progesterone, and I would love to share that with you. So I think those will be some upcoming video ideas, but I really want to focus it more on being super healthy in our 50s and 60s and beyond. What are you interested in? You know, I love to research stuff. I've done a lot of research into supplements, and I've really changed the supplements that I'm taking. Are you interested in hearing that? Anything that you're curious about, let me know down below. Leave me a comment. Show this video a little love. Give it a like. Hit the subscribe button. Thanks for joining me.